Hello, I'm Kelly Ferguson, the diabetes nurse, and I'm going to talk to you about hypoglycemia in the patient with diabetes. Hypoglycemia for someone who has diabetes is a blood sugar of 70 or below. It's very important that you recognize the symptoms of a low blood sugar. Symptoms of a low blood sugar include shakiness, dizziness, weakness, blurred vision, confusion. You could have a headache, you could suddenly be hungry. If you experience any of these symptoms, it's very important that you check your blood sugar. If your blood sugar is less than 70, it's important that you follow the rule of 15. The rule of 15 tells you to consume 15 grams of carbs, wait 15 minutes, and then recheck your blood sugar. If your blood sugar is still below 100, you should consume another 15 grams of carbs, wait another 15 minutes, and then recheck your blood sugar again. You want to continue this pattern until you have 2 readings of 100 twice in a row. 15 grams of carbs is 4 glucose tablets, a package of glucose gel, or a bottle of liquid glucose. It also includes 4 ounces of regular soda or 4 ounces of juice. 4 ounces is half a cup, and it fills about 1/3 of these small drinking glasses. The glucose tablets, gel, and liquid can all be purchased at any pharmacy over the counter. Once blood sugar is stabilized, meaning you have 2 readings of 100 or more twice in a row, eat a package of peanut butter crackers or eat a meal to prevent recurrent episodes of hypoglycemia. Let's do a recap of the rule of 15. Step 1, consume 15 grams of carbs. Step 2, wait 15 minutes. Step 3, recheck your blood sugar. Step 4, if your glucose is less than 100, repeat steps 1 through 3. And step 5, once your glucose is stabilized, meaning you have 2 readings of 100 or more in a row, eat a package of peanut butter crackers or eat a meal. Sometimes your glucose could get so low that you're unable to swallow or help yourself. It's important that you teach your friends and your family and your coworkers about the signs of hypoglycemia. Make sure your family and friends know that if you're ever at a point where you're so disoriented that you can't swallow, they shouldn't force anything down your mouth. Instead, they should call 911. If you're someone who tends to get low blood sugars often, speak with your doctor about getting a glucagon injection kit. A glucagon injection kit will look very similar to this. It includes a vial and a syringe. You should never be using the glucagon injection kit on yourself. If you're able to give yourself a glucagon injection, then you're able to consume some of those fast-acting carbohydrates that I talked about earlier. But you should become familiar with the kit so that you can teach your family and friends and coworkers how to use the kit. The best time to learn how to use one of these glucagon kits is not when it's needed, it's beforehand. Inside the glucagon emergency kit, you will find a vial with white powder in it and a syringe with clear liquid. Remove the cap from both the syringe and the vial. Insert the needle through the center of the vial. Push down on the plunger. This is mixing the liquid with the powder. Swirl the vial around. You don't need to remove the needle. Once you have clear liquid, turn it upside down and pull back down on the plunger. Now you're ready to inject. The glucagon can be injected in the arm, the butt, or the thigh. If you have an alcohol swab, then clean the area beforehand, but if you don't, you can skip this step. Seek medical attention if you have a low glucose reading that is unresponsive to treatment.